Okay, are we gonna? Thank you. Hello, everybody. I want to welcome you all to Pediatric Grand Rounds. I'd like to start with our land acknowledgement. We'd like to acknowledge the Ramaytush people who are the traditional custodians of this land. We pay our respects to the Ramaytush elders, past, present, and future, who call this place the land that UCSF sits upon, their home. We're proud to continue their tradition of coming together as and growing as a community. We thank the Ramaytush community for their stewardship and support. We look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. It's my great pleasure today to introduce our speaker for Grand Rounds, Kelly Hardy, who's a leading expert in California children's health policy and brings deep experience in Medi-Cal, reproductive rights, and advocating for the uninsured. She directs the health policy and research projects for Children Now, which is a nonpartisan research and advocacy organization that coordinates collective action campaigns to improve the lives of California's children through effective policy change. And we're looking forward to hearing today her clinical perspective in today's presentation on the current state of federal and state health policies and its potential impact on vulnerable children. And this is especially timely given the concerns that exist right now in terms of the future of Medicaid funding, with all the discussion going on at the federal and congressional level. And so, Kelly, please.
Yeah. Thank you so much. I'm really glad to be here today. And there's a lot going on, as we said, at the federal and state level. So I'm going to try to give you some perspective on what's happening from where I sit. And hopefully that will be useful for your work. I would love to have lots of questions. You can feel free to ask me questions while I'm talking and also at the end. And just know that I finalized this presentation at like 3:00 yesterday because things were so in flux, and then something changed. So I will be updating really as we go along. So a little bit about Children Now. We have been around since 1988. I've been with Children Now for 19 years. We work on early childhood, child welfare, education, and health, and really all the interconnected pieces between that. We seek to be a whole child organization. It's difficult to cover all of those topics. But we do the best that we can, and we research and advocate on a statewide level. So really trying to cover all of the kids in California. We are nonpartisan. We work in a partisan context at times, but we are a nonpartisan organization and very much work with all policymakers who are pro-kid. And we really push this pro-kid moniker because we're trying to keep it simple for people. Legislators are either pro-kid or you're voting anti-kid, and trying to keep it easy for folks. So a bit about the federal landscape, which, as I mentioned, is changing by the moment. Tomorrow, federal funding expires for most of the programs that the federal budget funds. There was talk of the House has passed a continuing resolution, which means that it sort of flat funds the government. It's not really flat funding. There's a little bit of cuts, but essentially flat funds the government through September. And there was some hope on the part of the House that the Senate would then go ahead and pass that continuing resolution through September to avoid the government shutdown tomorrow. There's some brinksmanship going on, as you can imagine. the Senate needs 8 Democrats to vote for the continuing resolution. And as of late yesterday, the Democrats in the Senate have said that they will not vote for the continuing resolution. And they're instead seeking a 1-month CR. So if you hear this CR language thrown around, that's what they're talking about. And who knows what's going to happen? I certainly don't. So if I'm guessing, I'm thinking they'll avoid this shutdown, or there will only be a shutdown for a little bit, and then we'll get a shorter CR because they do need those Democratic votes in the Senate to make that happen. This is all important because of funds for Medicaid, SNAP. I should have started there. This is all important because of the funding for the programs that keep kids healthy, that we rely on as hospitals, that pediatricians rely on, and that are necessary to support the kids. So I'm just getting a little in the weeds because it's fascinating to me, but may not be so to you. So best guesses are that there will be some sort of federal budget compromise by the middle of the summer, perhaps, so that we've got funding for everything in September. This is important because, like I said, they need the money to pass. They need the money for the federal government in order to make sure that that those programs are still funded. And what's been put forth so far around the federal budget are lots of cuts. So the House passed what's called a reconciliation package. You don't need to know any of those words, but essentially it has put forward something saying that there would be at least $880 billion in cuts to Medicaid, largely Medicaid, which is the purview of that Energy and Commerce Committee. Again, what's important to know here is that the potential cuts, which are shown positive here, but of course they would be cuts. It's positive in that they're, I think this is taken from the CRFB, which looks at increases in the federal deficit. And so the positive means it would not increase the deficit. The $880 billion would be a threat to Medicaid, a cut on the education and workforce. What's noted as $330 billion here would be a threat to child nutrition and school meal and higher education programs. And then the cut to agriculture is a threat to SNAP, which is a supplemental nutrition program that's known as CalFresh here in California. These instructions really that are being put forward are not yet final, but this is sort of the starting gambit for where we are in a very long process. Think of this as very much the starting line in a long federal process, but it's not a good one if you like Medicaid and SNAP intact. Just for some perspective on what that $880 billion, at least $880 billion cut would mean, the Nonpartisan Congressional Budget Office did a report on March 5th, which now seems quaint that, it's so long ago, that $880 billion would necessarily cut deeply into Medicaid. The non-Medicare, Medicaid, and CHIP, Children's Health Insurance Program funding that would be available to cut is only $135 billion, which is just a fraction of the $880 billion that's in there. Some of the members of the House who voted for the reconciliation instructions said, oh, we're not going to cut Medicaid. And this CBO report says, yes, there is no way to find $880 billion without deep cuts to Medicaid. So that's just what we're showing here, is that those talking points are interesting, but they're not true. So what are some of the, and I promise there's some good news towards the end of the presentation. What are some of the potential ways that policymakers have talked about cutting Medicaid? Top really of the list is capping spending through block grants or per capita caps, which amount to the same thing, less money to states. And that's a theme that you'll see. There's many ways to cut Medicaid, but many of them are just cutting the amount of funds that would be going to states. And then states have to decide, how are they going to parse out that money? Are they going to make cuts to providers, making it even harder for providers to serve kids and others? Are they going to make cuts to populations? For example, saying that undocumented folks can't have Medi-Cal the way that they now do. The state then has the responsibility to figure out what to do with those cuts from the federal government. Other things that the feds can do are around changes to the matching rate. Again, these are all fancy ways or not fancy ways of just cutting the amount of money that's going to states. Repealing regulations. There's also a potential in there that has been floated, that states like California and New York, who cover undocumented immigrant populations through their Medicaid programs, would get a penalty. Not just that they wouldn't get funding for those populations, which they don't from the federal government, but that they would be penalized for covering those populations. So I would note that many of these same this list has been around since I was in grad school and much before that, doing a paper on potential cuts to Medicaid, right? So it's been around. It's scary to think about. In 2017, many of the same cuts were proposed. Many of them were fought back. And those of us who really like Medicaid hope that that will happen again. But this is where we are, just to know about what some of the threats are. Work requirements are one of the pieces that's been put forward, I would say has the most agreement amongst policymakers in Congress. That is a requirement that folks who are on Medicaid prove that they're working. You may know that most people who are on Medicaid are working, or are children who I hope are not working. So they're already working. This is another way of sort of making it more difficult for people to get Medicaid. And that's where the savings comes from. It's not from really denying Medicaid to folks who are not working. That's not really a thing so much that happens. Again, hospital and provider payment cuts, which would impact you all really importantly. One of the pieces that's on the table is around provider taxes, which is an MCO. You may have heard about an MCO tax. Yes? No? No. Okay. There's a way that California and many other states fund Medicaid by taxing managed care plans, managed care organizations, MCOs, and then using that money, that pot of money that they get from managed care plans as state match to draw down federal money. This is legal. It seems like maybe it shouldn't be, but it's legal, right? And sometimes the federal government threatens to take away that way of using managed care money to draw down federal match. That would cost California billions of dollars. So it's a concern for sure. All right, just looking at my notes. Oh, important to tell you that these cuts would be over 10 years, not all in 1 year, over 10 years. It doesn't make it better. It's still $880 billion. But those cuts would be would be spread out. And I already mentioned the concerns about keeping our undocumented populations covered. That's something that Children Now and many others have worked on for over a decade to make sure that undocumented kids and others are covered by Medi-Cal, and something that we really would be very concerned about if it was subject to a rollback. I know a lot less about nutrition assistance programs, but I thought it would be really important to mention these. You all deal with whole children who don't just come in with medical issues, right? They come in with all sorts of different issues. And the potential cuts to SNAP are also really important. One thing that has already happened as of a few days ago is $1 billion was cut from programs that that sort of our farm to school food programs. So making sure that sort of local farms are getting food to schools for school meals. So that has been canceled for schools and food banks. And then there's also concerns about work requirements and the same types of sort of cuts to SNAP that I mentioned for Medicaid, and concerns about cuts to school meal programs. There's something called a community eligibility provision in school meal programs, which means if you live in a low-income neighborhood, we don't make every single kid prove that they're low income. We just assume that everybody in the school gets free lunch, right? That's called community eligibility. And it saves a lot of paperwork, and it's a very efficient thing. The federal government, some lawmakers have proposed putting that on the table, that would not be allowed anymore. Again, it's a way of increasing the paperwork burden so that more people fall off of getting supports that they might need. And then there's the other page. So this is, those are Medicaid and SNAP are more of the knowns. Here are many of the unknowns or semi-knowns. Fluoridated water, I will talk later about a bill that Children Now is sponsoring around ensuring that that kids in California at least are getting the fluoride that they need for their teeth to stay healthy. But that has been something where there's concern about making sure that communities keep their water fluoridated, and that's been posited as a way, as a rollback. Vaccines, which I would imagine this crowd is especially concerned about. We've seen, I shouldn't laugh, I have to laugh sometimes. We've seen over the last week or so, especially, that the measles cases that have been coming up in Texas and other states, that they've made their way to California. And so LA and Fresno have had cases. As you likely know, measles needs 95% herd immunity. 2/3 of our counties are below that 95% threshold for their kindergartners. So this is a real problem, and something that I keep telling all of my friends, make sure your kids are all up to date on everything. Federal relief funds are a concern. If there's more California emergencies going forward, will we get the relief funds that are needed? And then other changes to the Affordable Care Act, or Covered California, as we have it here in the state, including taking away benefits or subsidies, again, making it more expensive or more difficult for folks to get insurance. We're at a point where 97, 98% of our kids in California have insurance, which is great. And we would really hate to be going the other direction on that. through Medicaid or ACA cuts. One thing I would point out is RFK, as head of HHS, has put forward this Make Our Children Healthy Again assessment and strategy that's worth taking a look at. And I have linked it, which I'm hoping you'll get the slides at some point, or I'm happy to follow up. There's a focus on chronic childhood diseases, and there's a strategy document coming out on August 12th, or that's when it's supposed to be coming out. And I think it's really worth keeping an eye on what kind of chronic diseases are being focused on there, what's being proposed. Is it something that, is there anything there that, that, you know, this crew, other children's health advocates can get behind or be concerned about? I think it's really worth taking a fine-tooth comb to that information, both as it is now and this strategy that's coming out later in August. And then there's concerns about public comment and just overall transparency and openness. One piece is this Richardson waiver, which I don't expect you all to remember, but another piece that is front and center with this continuing resolution is that a CR allows for more flexibility on the side of the executive branch to be making cuts without going through Congress, including cuts through the Department of Government Efficiency. So that's a concern around cuts and also transparency. I should also mention the Department of Education just cut 1,000 jobs. Of course, that impacts our kids as well. And you all probably know better about what's happening at the NIH, but that seems like a big concern. I'm going backwards here a little bit, just so, and this may be review for most, if not all of you, but just a current snapshot of what the Medi-Cal program does and is in California and how important it is for our kids and families. Here's who it covers. And kids are currently at 266% of the federal poverty level, which is about $71,000 for a family of 3, anywhere in the state, anywhere in the nation. So, you know, $71,000 for a family of 3 goes far further in some places than it does in others, like San Francisco. These are the types of folks that are covered. And 41% of all Medi-Cal enrollees are kids, and 57% of our kids 0 to 5 are enrolled in Medi-Cal. It's a huge program for supporting our kids' health. Sort of we think of it as the bedrock that everything else layers on top of. It's approximately 5.5 million kids in Medi-Cal. And as you probably know, it's a state-federal partnership around the funding. So the state puts up somewhere under half of the money, and the feds put up a little bit over half of the money. We're mostly, through many, many years of continuing to push, mostly our kids are in managed care. And the number, while it peaked during the post-pandemic sort of era where kids and others were not being kicked off of Medicaid at all. So that's where you see this peak in the number. We're still, you know, very high as far as historically with our Medicaid numbers. What does it cover? All of the things, it's supposed to cover all of the things that kids need. Sometimes it's difficult to find a provider. And I know that providers are not paid as much as they need to be to provide these services, but it is intended to cover all of the things for kids. Oh, and okay, federal funds for Medi-Cal make up over 1/3 of our total state budget. So it's a huge economic driver for the state. All right. These are just some resources that I kind of reiterate what I said around how important Medi-Cal is for kids, for the state, for our economy, and for the overall healthcare system. So I promised a little bit more good news. And the state, while we can't insulate entirely from any cuts that might happen at the federal level, the state is generally doing what it can to make sure that kids are healthy. Budget is not the worst and not the best that it's been over the past 20 years that I've been understanding it. So as of last night, the governor borrowed $3.4 billion to make sure that Medicaid providers are getting paid. That's not a great sign. But there's a lot of borrowing that goes on in the state budget, a lot of going from cash to not cash, whatever the other one is, accrual maybe, a lot of back and forth to make sure that the numbers work out. So I think there's concerns about the state budget and a deficit, but again, it's not the worst that it has ever been. There've been times when there have been lots of cuts that have been prescribed. This is all pending any federal budget cuts, of course. So just a brief look at what our state budget process looks like. So right now, the legislature is holding hearings on what's in the governor's budget proposal. These are important, but a lot of where the rubber meets the road will happen in May and beyond when we get our tax returns, knowing how much money the state is really going to be able to count on from all those IPOs and really rich people submitting their taxes. And so we'll have a better idea after May of what kind of money the state has and needs. And also, of course, some better idea of what's going to happen at the federal level. I should say in the state budget, the January budget proposal, it was mostly pretty good for kids' health. There was a notable exception around not funding the hearing aid coverage for children program, which I'll say more about later. So that's something that we're really focused on and working on. But generally, the governor's budget proposal in January did fund the kids' health programs that we're concerned about. The state legislature, as always, there's been a ton of turnover because we have term limits in the legislature. So there's a third of our legislative members are new. And it's amongst the most diverse that it has been ever, with people of color holding more than half of the seats, finally getting near gender parity and at parity with LGBTQ plus members. So that's an important piece. There was a special session in December that the governor called to try to think about potential federal actions and federal cuts that they could get ahead of. That was largely around legal challenges that the Attorney General could make, and less about these cuts that will continue to sort of percolate and be discussed throughout the year. And hopefully we'll get some resolution over the summer. So the priorities that children now, and many of our partners, we work in like 90 different coalitions with other organizations across the state, including AAP California, CMA, and other groups. Our priorities are around access to preventive oral health services, holding health plans accountable for delivering the care that they have said that they would deliver, that they're contracted to do. I mentioned the hearing aids piece, and we're continuing to work on that. It's a smallish population, but we feel both morally and just monetarily for those families that it's a really important issue. Keeping kids covered in Medi-Cal up to age 5. And we have a relatively new, over the past 5 years, we've really been trying to do more on environmental health and justice work related to kids. So I'm going to get into a little bit more detail about each of these. How am I doing for time? Great. Okay, so on oral health care, we have a bill. AB means Assembly Bill, 350 is the bill number, and then Bonta is the author. So this is Mia Bonta, and she's based in Oakland. She's really great. This would expand coverage of fluoride varnish. So that's sticky stuff that you guys probably do this for kids now. Some pediatricians, okay, great. Pediatricians are allowed to apply fluoride varnish, but it's less common than having dentists do it.
Also, some of these people are inpatient, and it's the people in the outpatient.
Got it. Thank you. I know very little about doctoring, so I just think of you all as like pediatricians, which I know is not as specific as it needs to be. This is just a little graph to show us how, we're really behind on fluoride varnish for kids, which is one way that we can help protect their teeth. Teeth are part of the body and can have lots of impacts on overall health, as well as just dental health and social comfort, ability to concentrate in school. Dental problems are one of the number one reasons why kids miss school. So really a top thing that a lot of people are not paying enough attention to. I consider a point of pride that my child is 13 and hasn't had a cavity yet. I had several by that time. So that's one piece of work that we're really focused on. I mentioned holding health plans accountable. This has been several years in the making. We've had several iterations of this bill, but it's around requiring plans to go to report their denials of care. So right now, you have to it's a second job in order to try to fight as a parent and to fight a denial of care. So lots of people give up or don't know that it's an option. And so we had originally tried to get denials of care to go straight to an IMR, an independent medical review. And this is a compromise bill around public reporting of those denials of care, because something like 80% of them, if they're fought, they get overturned. The denial gets overturned, the service gets provided. So our thought is, why are we doing that in the first place if it's not to try to keep kids from getting the care they need? Controversial statements, but nonetheless. And you may see one side of this that, parents often report difficulty, especially in getting behavioral health care for their kids, amongst other things. Hearing aid coverage. So look at all these beautiful states, the blue states, where kids' hearing aids are covered in private health insurance. And we are not one of those states, and we should be. These essential health benefits bills, which are the bill numbers at the end there, those would include hearing aids for kids as one of the essential health benefits that needs to be covered by plans. This is, as I said, this is a smallish number of kids, 20,000 kids, but I bet it's super important for those families. And in fact, we have some great families who've stood up and shared their stories. Other notable legislation. So I mentioned multi-year continuous coverage. We need an acronym for everything. This is the idea of keeping kids in Medi-Cal from 0 to 5 and not making them renew each year. It was approved, but no money has been provided for it to be implemented. It's not looking great for it to happen this year. But we think this is an important way to keep kids covered and avoid that churn in and out of Medi-Cal that happens so often. Even when people are still eligible, they churn in and out because they moved and they're not getting their mail or whatever is happening. The Safer Soap Act would take 3 very toxic ingredients out of hand soaps and body washes. I'm not even going to try to pronounce these. It exempts healthcare settings, really important to note, but would be a piece in the fight against microbial resistance. Yeah, saying that correctly. We don't want that, so we're fighting against that. So that's a bill that we're co-sponsoring with Women's Voices for the Environment. And then another bill by Mia Bonta, AB 298, would prohibit out-of-pocket healthcare costs for kids and young people. What a great idea. We're supporting that one. We're not sponsoring it. And that is the end of my presentation. I would love to hear what you're hearing about federal and state context. As I said, the federal news is not great. And we have fought these battles before, and many people are mobilized to work to make sure that policymakers have all the information that they need when they're making these decisions. And at the state level, we're trying to do what we can to really protect kids' health and at the same time move forward in smallish or maybe bigger ways if we can in this current environment. So again, I'd love to hear your thoughts and questions.
Interested in
right, yes.
So children with chronic conditions. So, we see a lot of children, for instance, with chronic pulmonary disorders, and that interfaces really closely with the environment, both in terms of just healthy air in general, and also here in California, wildfires. Are those kinds of things part of these plans, or is that something that's just not considered, or how are those things being brought together or not?
Right. There is, so I'll be really honest, I haven't focused as much on that piece as I have again on the Medicaid cuts. That's really where a lot of attention is focused at the moment. And I'm interested in this strategy that they're hopefully going to be pulling together by the summer. What I have seen, so I've skimmed through the document that they have so far, is a lot of focus on food dyes and artificial ingredients in food, and autism. Not connecting those necessarily, but those being two important pieces. So I haven't seen as much focus on asthma or lung disease or anything like that.
Yeah, I guess I'm just wondering who's defining chronic disease.
Yeah.
The artificial dye that I don't know the answer, but I guess it's.
And I also don't know if there's room for input into this strategy that they're developing. So it's something that I want to learn more about, but I haven't done a lot of investigation yet. Do others know more?
Well, I wouldn't say that I know more, but I read the Making America Healthy Again, a document that came out of the White House. And it actually, what strikes me, and this is why I was wondering if you knew about opportunities for public income,
Right.
et cetera,
Right.
that you read that document and you go like, great, this is good news for children and for pediatricians and for everybody.
Yeah.
Because it focuses very much on healthy food and more research to really examine what causes chronic diseases, etc. But then in the meantime, this cuts to the farm, to SNAP, and also the local farm programs,
Right.
is absolutely contra what is explicitly said in there. And so I suspect the answer to the question is there's this chaos in the White House and nobody knows what one part is doing and there's a lot of contradiction. But since I'm really glad to get such a coherent view of what you're focusing on, gives me some hope that not everywhere there's chaos. Like, what are the ways in which that the community and your organization and the state can actually try to battle that chaos and say, wait, action A and action B cancel each other out or are not, cannot be reconciled?
That is $1 million question, isn't it? Or billions of dollars. I would say at this point, what Children Now and other California state-based organizations are focusing on is making sure that our legislators, both in our state legislature and our members of Congress, know about the importance of Medicaid for kids, and that we're really staying true to those talking points. I don't know how to battle the chaos part. I think where there are opportunities for input, putting those ideas forward, as I said, that might be resonant with this Make America's Children Healthy Again framework. I think that there may be a path forward there. I'm not sure that I really have an answer. We're trying to stick to our lane as far as really educating our policymakers about what's important for kids' health. And to the extent we can, not getting too distracted about, everything.
Dollars, essentially Medicaid. The impact dollars.
If I don't have it right here, I can get it back to you. 10 to 20 billion or more is what I've got.
So the state of California would use this year or across the several years?
Across the 10 years. But I think that's the number that I have, but I know that 880 billion is a floor of cuts. It's not the ceiling of what they're supposed to cut. There's a lot of those resources that I linked go specifically into county by county or district by district, what the impact would be in terms of numbers of kids, dollars, numbers of people overall that are cut. But it's also tough to know without knowing what the cuts would be in the 880 billion or more. So if it's work requirements, it would kind of cut one way. If they're doing a straight per capita cap, that would cut, a different amount of money. So there's estimates out there, and there's some good breakdowns again by county and by district that are linked in those fact sheets back here. These fact sheets have, especially the Labor Center has got some good information there. Other thoughts or questions?
There's just a comment from the Zoom that AB 350 also expands fluoride varnishing for each AP. And then
Great. I know that I still get fluoride varnish, so I think it's supposed to be for everybody, right? Yeah. All right.
thank you very much for coming.
Thank you. Hi.
I had a question that was